can IgE-mediated food allergies be outgrown? This is a great question. First, I want to, again, tee up the fact that when we have littles who have food reactivity, there are two main categories. And the first and most often what we think of when we think of a food allergy is an IgE-mediated food allergy. So this is little Timmy getting a peanut, going into anaphylactic shock, needing an EpiPen in the thigh, and having to go to the hospital, right? Those like life-threatening, super scary reactions. And those IgE-mediated reactions also can come in more mild symptoms, all the way up to these severe reactions like I just kind of explained. That's one category of food allergy. And then the other that more often we see for infants is the non-IgE-mediated food allergies with those other symptoms I just mentioned. So for an IgE-mediated food allergy, it is absolutely possible for them to outgrow these triggers. A few things that's really important to note is that the younger that the child is, the less accurate the tests are for them. So the two main ways that we can test for an IgE-mediated food allergy is through a skin prick test or a blood draw test. And there's pros and cons to both, but what's important to note is that sometimes when we have younger children, we will have them do a skin prick test, for example. It will come up with several things that are positive, and we may find that in reality, there's only a couple of those things that were positive that are truly, actually positive IgE-mediated food allergies. So what I always recommend is if you have testing done while your little is still very young, to retest those skin prick tests or blood tests to confirm that those are still positive, because you may see that as the immune system's developing and the test becomes more accurate as they get older, some of those may not actually be positives for your kiddo. And if you're working with an allergist with your IgE-mediated food allergies, oftentimes they will even offer to do an in-office oral challenge. So trialing that food in office if you've never seen a reaction to this particular food. So for example, I have a baby, they are 6 months old. I suspect because we saw hives to eggs that there's an egg allergy. We do a test, and they come up positive for egg and for almond, but we've never trialed almond. So in that type of scenario, we may just wait another 3 months and retest to see does it still come up positive for almond, or we may decide to do an in-office oral challenge where we actually trial almond in the safety of the allergist office in case anything happens, because that's the gold standard for an allergy test, whether it's IgE or non-IgE, is to actually trial that particular food. And if yes to both of those things, right? If yes, my baby definitely has an IgE-mediated food allergy to this food, and we know for sure that it is because we've seen a reaction to it, or we've already done an oral challenge and we've seen a reaction to it, they still can outgrow food allergies. Just like the fact that you can have a new food allergy at any point in your life. It can be onset at any point in your life. You also can outgrow at any point of your life too. And there are specific like tolerance programs for IgE-mediated food allergies that you can look into as well. We have a great blog on this. If you go to our freetofeed.com/blog and put in OIT or tolerance, that will pop up for you, and definitely recommend that you give that a good read if your kiddo has an IgE-mediated food allergy.